Hi everybody, I've been out at a union protest today. I decided to get my act together, and this is some footage which includes some speeches from today's protests outside the Domain in Auckland. Here's me on the ferry looking really shaggy, having a bad hair day. I got off the ferry and I got an Uber, and next thing you know I was up at the protest.
I'm out here because the union voted to protest and I'm a union member, and I do support the idea of telling people that there's a big problem with healthcare here. The whole plan was, let's just undo whatever Labor did. That's their whole agenda. That's not creative thinking, that's just undoing what the other guy did. All the G News announcements come along because I think health is probably the most important consideration for a lot of people, even if they voted for this coalition. We all need healthcare, as the lady here said at the beginning, and it's pretty clear that a lot of people really care about this, and might be about time that the government did too.
We are here along with thousands of workers, not just health workers around the country, to fight back against the government's attacks on the health system. The government is squeezing this system dry, and they say it's not affecting clinical staff, and they're not losing their jobs, but they are leaving. They are having their recruitment frozen, they're having their overtime cut, they're having their conditions cut, and their support staff are being pulled out from under them. So that is affecting patients every single day, and it's just, making our members go over the ditch. So we're here today to start the fight back against the government. Who is also here. And we want to thank all of our opposition MPs for the work they are doing to resist the government in Parliament and their support for what we're doing on the streets. Look, we are here today, and thousands of health workers and other workers out around the country because this government is squeezing Te Whatu Order dry. Every single penny they can squeeze out of the health system. And they say that it's not affecting the front line. Do you guys think it's affecting the front line? Hell yeah! Because they might not be firing clinical workers, but they are cutting your overtime. They are reducing your terms and conditions. They are cutting the workers who support you, adding to your workload. So we know that when they say that clinical work is not being affected, they're lying. So we're going to hear from a few groups of workers today. I'm not the main character. This is all about our members.
E te kaihanga o te wāhi ngaro, e mihi ana mō te hā o koutou oranga. Kia kotahi ai o mātou whakaaro I roto I te tū wāhia. Kia ai mātou ki te pono me te tika, te ronga I tō tātou ingoa tapu. Au mie, hui e, tai ki e. For the wairuatanga of all things, and to the areas there that kind of is part of our creation. Thank you for the life that we breathe to help us to be of one mind as we seek to be of service to those in need. Hey, that's us, isn't it? Give us the courage. I think we need this today. Give us the courage to do what is right, and help us always to be aware of the need to be fair and transparent in all we do. Hey, isn't this what this is about? We ask this in the name of all those things that bring us together. Amen. Ka pai tēnā.
I'm from the TU, I'm the rep across the road. I'm a clinical coordinator running a rare disease study. For 5 years I was an NZNO member, for 5 years I was a FLEB. And I thought it was shit 5 years ago. It's appalling now. So, I want to say, everybody, stick together, fight back. The changes the government's trying to make to the health system falls down on universities, on everything.
waiting for over a year for a pay rise over here. And many other places will do it. If we give them an inch, they'll take a foot. So I'm going to lead you through a chant for solidarity. When I say union, you say power. Union! Power! Union! Power! When I say union, you say power! Union! Power! Union! Power! Well done, everyone. Kia kaha. Keep up the good fight. Do not let the bastards get you down.
We call on the government for safe staffing. Healthcare across Aotearoa New Zealand is in crisis. That is because this government continues to underfund and under-resource health services. Patients and whānau are waiting for far too long to access care, sometimes not even getting to the point of treatment. And at the heart of this crisis is chronic understaffing. There simply aren't enough of us people on the ground to do the mahi, to give care to those in our communities who are needing that care. And that understaffing is not an accident, my friends. That is the deliberate result of deliberate undervaluing and underfunding from this government. Let's all be clear about that. The responsibility here lies with this government. The buck stops with them. It has been their decisions that have led to our health system reaching the breaking point that we find ourselves in today. And that is why we've all gathered here to demand that this government properly fund and properly resource the health services that are needed by our communities. Instead, what have we got going on? In our public hospitals, Te Whatu Ora have put in place a staff hiring freeze. Attempts to meet a government-imposed cutback and artificial budget constraints, which begs the question, why? What's their motive here? Do they not understand the statistics? Do they not know what the evidence is? Or do they just simply, worse, not give a shit? Do they not care? Do they not care that Aotearoa remains to be in a mental health crisis? Do they not care that non-communicable disease rates continue to rise? And that Māori and Pacific whānau experience worse health outcomes than most of other people here? And that to actually adequately resource these inequities, we need well-resourced services, not underfunded and defunded services. It's fucking stupid. As you would expect, this hiring freeze is already having serious consequences. Stroke survivors are facing longer wait times and are losing access to the community rehabilitation programs that they're needing. In oral health, delays mean that babies and tamariki are waiting in limbo for surgeries for cleft lip and for craniofacial problems that they have. In child and adolescent mental health services, young people are being cut off from support that could change and in fact save their lives. Ultimately, it's our patients and our whānau that are experiencing the significant cuts that this government is imposing on us. And you know what? Meanwhile, us health workers are expected to keep the system afloat on menial pay increases of, as Will put it, less than 1%. It's simply laughable and unacceptable. The coalition government needs to commit to funding safe staffing levels, not just in our hospitals, but in aged care and community services and primary care services, so that every New Zealander can get the care that they need when they need it. Now, my friends, here is my appeal to you. While we wait impatiently for this government to do the bloody right thing and properly staff and fund and resource our health services, we cannot afford to sit still. We need to collectively act. We need to make our own spaces safer for ourselves, our colleagues, and our patients, using the tools that we already have. Now, what do I mean by this? If you're a PSA or an NZNO member, you have in your MECA an escalation pathway that allows you to say no to additional work when you feel you've reached your safe limits of practice. No one else can make that call for you. Only you can say when enough is enough. So don't wait until you're overwhelmed and burning out. Anticipate it. We're all skilled and knowledgeable clinicians. We know when our workloads are unsafe, when our registrations are being compromised, when the lives of our patients are being compromised and they're not receiving the right care. That's when our safe limits of practice are being breached. That's when we can use our escalation pathway. So use it. That's what it's there for. That's what our union organizers and negotiation teams bargained for us. It's all there for us to use to keep ourselves and our patients safe. Talk to your health and safety reps. Get advice from your union organizers. Take action collectively and individually, because we can't keep waiting for this freaking government to make things safer for us. We've got to do it ourselves a little bit as well. And if we've learned anything from them, we're not going to get what we want unless we demand it. So let's keep the pressure on. Let's hold this government to account. Let's demand that they staff and properly resource our health services. And while we do that, let's look after ourselves. Let's look after each other, and let's look after our whānau and our patients, using the power that we already have, because we are the ones that hold this system together. Kia ora.
Tēnā kina mana whenua. Kia ora koutou everyone, and thanks Will for giving us an opportunity to speak to this. Today we're calling on the government to stop health cuts. Health cuts hurt services, the patients who rely on them, and the workers who deliver them. Under this coalition government, we've seen departments restructured, roles disestablished, change proposals enacted, and hiring freezes implemented. In our department alone, and I've worked in healthcare for 13 years, and we're a small team of about 15. We've had a couple of our vacant full-time roles disestablished. We've had a guy who resigned and went to Aussie, and they haven't replaced that person yet. And because of the hiring freeze, we're not sure when that's going to happen. There's also another issue for us, and we've got these big floor-to-ceiling shelving units. We've been asking for them to be repaired for months and months and months, and they've already fallen on a couple of people. These are big shelving units with wheels on them. They're big mobile units that we store everything in. They've fallen on a couple of people, and we've pointed it out to our boss a few times and asked for them to be fixed repeatedly, and we've been repeatedly told that we don't have the funds to do that. So this is how we're experiencing these cutbacks. Shame. Hard out. Yeah, exactly, Will. Make no mistake, this is austerity. This is managed decline. The coalition can talk all about that, talk all they like about spending more on healthcare. The reality for those of us on the ground is that we know that money is not being spent where it's needed. If you've been watching, you may have noticed there's a narrative driving all of this too. Since day one, the coalition have been repeatedly accusing the health sector of wasteful spending. You might have heard of that term. These accusations have been weaponised and used to attack everything from the hiring of new nurses to Whatuora's leadership team and administrative staff. Shame. We've seen these tactics before. In the UK, Conservative governments have used exactly the same narratives to undermine their National Health Service. Rising public dissatisfaction there from increasing wait times due to systemic underfunding of the NHS has resulted in more public funding being spent on private providers. And yeah, shame. And now we're seeing it here. In the UK, just the other week, newly appointed Health Minister Simeon Brown used lagging wait times to announce that the government were increasing spending an additional $50 million of public money, which would be spent on outsourcing our elective surgeries to private facilities. Shame again. Shame. This is the slow creep. This is the slow creep towards privatisation, and we should be concerned. It should be concerning to all of us. The coalition will, of course, deny it, as they have done. But as health workers and unionists, it's our job to resist it. If we don't, we risk having our public health system slowly stolen away from under us. The Coalition Government must accept its responsibility to ensure we have a health system that provides for all of us. That includes free access and the adequate resourcing of health workers to provide it in public facilities. And when we stand together like this with our unions, we have the power to demand it. Stop the health cuts. Stop the privatisation of our healthcare. Yeah. Keep our hospitals public. Maranga Aki.
Can we give a round of applause for Megan? So, bear with me. Cool. So, kia ora koutou. My name's Megan. I'm a third year nursing student at AUT, and I have the absolute blessing and opportunity to sit on the National Student Board under NZNO as a Tūronga Tauira representative. I have the blessing to speak to you guys today about nursing students. I started to do my nursing degree due to wanting to help the people that were most vulnerable and likely to, without monitoring, fall through the gaps and therefore likely die. But I can't do that without finishing my degree. Over the course of our 3-year degree, students are expected to work a minimum of 1,100 hours unpaid. That's at least 137 and a half full working days. I say minimum because if we have to repeat a paper for any reason, we have to redo those clinical hours. We're not sitting in lecture halls during those hours. We're on the wards. We're doing real work, taking up to 3 patients per paper, per shift on episode papers, carrying out all their cares, assessments and documentation under the supervision of our preceptors, the registered nurses. With the unpaid workforce proving up an overstretched and understaffed system. To do these placements, many of us have to take unpaid leave from our part-time jobs. Yet we're still expected to cover things like transport, hospital parking, uniform, meals, and on top of that, we're still in a cost of living crisis. I don't know why students are not paid for our training, or police cadets are. Can this government explain that? We're told constantly we're the future of the healthcare, but the future is dropping out. According to National Student Nursing Student Unit's 2023 survey, 1 in 3 nursing students drop out of the second year. Most of them are Pacific and Māori students, not because they're not capable, but because they simply cannot afford to continue. I personally know students who are living out of their cars, couch surfing and skipping meals just to show up to placement. I have personally skipped meals and experienced relying on the help of others to help me make ends meet while on placement. It's scary checking my bank account every week and trying to work out if I can both afford to eat and make it to placement. I cover the cost of public transport to my placement, and more likely than not, it ends up with me skipping meals. And when we finally get to our end of the tunnel at the end of our degree, what's waiting? In the most recent intake, only 52% of new grads were offered jobs through the Net PNS program. A few years ago, under the previous government, that number was closer to 100%. That's not a coincidence. That's a system in crisis. I want to become a nurse so badly. I want to be able to help patients, especially the ones that are struggling and treated. But right now, we the students are struggling to even get through our degree. I'm asking this government not to forget about us when you talk about healthcare. Fund the system properly, pay the nurses, and of course, pay our students for our placements. Sorry. Because we want to be fully present for our patients. I'm anxious. In June, I start a placement that has 24/7 rostering for our third years at North Shore. That means I'm rostered Monday to Sunday and I can work any shift. And that does mean that I cannot work a normal job as well. And they can be as long as 12-hour shifts. So today, I'm asking the government, whoever is listening, to think about the health system. When you're sitting in Parliament, and ask yourself, why are we giving landlords tax cuts when we cannot give the health system, when we expect the health system to take that cost? I again stand here on behalf of the next generation of nurses we're ready to care for this country. We just need this government to care for us. Thank you.
Hi, Kira. My name is Falguni, and I'm a care support worker for 10 years now. We just want pay equity for a long time, and we're waiting and we're speaking hard, but nobody listening in the deaf ear. We're looking after parents, we're looking after their grandparents, we're looking after the neighbors, but we can't afford to look after our own family, right? And they always say that we are undervalued, we're not doing the things that the health system doing, but we are very skilled person. We have got the stages that we use our skills every day to the home, and some of the support workers are on a minimum wage nowadays, and we can't afford to keep going like this. We use our own car, own petrol, we have to do regional, we have to do walk, everything, and we just subsidize this government. If we are not going to the care, to the client home, they will end up in the hospital, and they will be costing more millions. And we are still waiting for the pay equity for like quite a long time. And we can't afford to fill even our petrol in our car nowadays. And it's very hard for us. And our voices keep clear to the government now that please fund the pay equity now, or we will be losing so many skilled workers, and there will be a shortage of staff. It's already a shortage of staff, and they are hiring these support workers that they can't do the whole hours. They're doing the part-time job as to cover the cost. And behalf of all support workers, they are finding very hard to choose between the rent or the groceries. So our voice are clear. Fund the pay equity now and support us.
Tēnā koutou katoa, ngā mihi nui kia koutou i hui hui mai nei, tēnei rā. What an amazing turnout today. The weather is terrible around New Zealand. There are storms everywhere, but around New Zealand there are groups like this, like your group here today, fighting back against health cuts, and there are groups fighting back against the government's cuts. Not only around New Zealand, but through Auckland there are 4 meetings today, so it just shows the strength of feeling against this government's agenda that we are seeing with health workers. I wasn't expecting to speak today, but I came here to stand along beside you and to listen to what you had to say. And I have to say, what I heard was absolutely appalling. It is not good enough that people who are training to be nurses have to choose between eating and studying. It is not good enough that care and support workers are on the minimum wage when they should be on a much higher wage due to the pay equity settlement. It is not good enough that doctors are forced to take historic strike action to get this government's attention. And it is not good enough that nurses are constantly working for safer staffing levels to be able to provide the services and the care that they want to be able to provide to their patients. So I, on behalf of the Labour Party, on behalf of the opposition parties, we stand firmly against this government's agenda of cuts. We stand firmly against privatisation, and we stand with you in the need for safer staffing and better conditions for health workers around New Zealand. So thank you so much for being here today. It's just amazing to see so many of you turning out to fight this. We know that this will be a long battle ahead, but let me tell you, when there is a change of government next year, you will see safer staffing, you will see rights for workers going forwards, not backwards, and you will see the respect that the health workforce, including care and support workers, deserve. So thank you for coming out today. Thank you especially to the speakers who spoke up on behalf of their professions. It is a brave thing to do, to speak up on behalf of all of your colleagues in front of your employer and tell them when they're getting something wrong. You are courageous and you are being heroes not only for yourself but for the New Zealand public, because we know that everyone in our family, our children, our neighbours, we all need a health service that works. We all need that for our future. And so you coming here today, being here in the rain and the sun and the wind and speaking up about it shows that you understand and you are willing to fight for a better future, which hopefully is just around the corner. So keep up the fight, fight back, mararangake, and we're with you.
I hope that footage was worth watching and gave you a better appreciation and some more coverage than you might get on the mainstream news. Have a great evening, everybody. Catch you all later.